Why don't you describe for me, as vividly as you can, what it is you're worried about, what it is that the nightmare scenario looks like?
Fortunately, there's very few things, and most of them are very low probability. Some big volcanic explosion, gigantic earthquake, asteroid. At least in the nuclear case, you've got to say we take it quite seriously. We budget a lot of money, have a lot of people who think about nuclear deterrence, and I'm very glad that work's being done, and I rate the chance of a nuclear war in my lifetime as being fairly low. I rate the chance of a widespread epidemic far worse than Ebola in my lifetime is well over 50%.
Those who are watching this would not forgive me if I also didn't talk for a moment before we wrap this up about your other passion in life, which is technology, of course. I want to show you something that was part of an interview that you did with us about 20 years ago. It's not a gotcha, and you'll pardon that it's an iPad that I got to show it to you on. But watch this clip of yourself here.
A wallet PC, a personal portable computer that helps run your life.
Well, you'll carry it around and look at your schedule, get messages from your friends. You can have pictures of your kids that you can show to everyone, and it can store any number of those. It's really the thing you need to carry around because it'll even have tickets or money stored electronically on the wallet device.
When I was a kid, the disaster we worried about most was a nuclear war. That's why we had a barrel like this down in our basement filled with cans of food and water. When the nuclear attack came, we were supposed to go downstairs, hunker down, and eat out of that barrel. Today, the greatest risk of global catastrophe doesn't look like this. Instead, it looks like this. If anything kills over 10 million people in the next few decades, it's most likely to be a highly infectious virus rather than a war. Not missiles, but microbes. Now, part of the reason for this is that we have invested a huge amount in nuclear deterrence, but we've actually invested very little in a system to stop an epidemic. We're not ready for the next epidemic. Let's look at Ebola. I'm sure all of you read about it in the newspaper. Lots of tough challenges. I followed it carefully through the case analysis tools we use to track polio eradication. And as you look at what went on, the problem wasn't that there was a system that didn't work well enough. The problem was that we didn't have a system at all. In fact, there are some pretty obvious key missing pieces. We didn't have a group of epidemiologists ready to go who would have gone, seen what the disease was, see how far it had spread. The case reports came in on paper. It was very delayed before they were put online, and they were extremely inaccurate. We didn't have a medical team ready to go. We didn't have a way of preparing people. Now, Médecins Sans Frontières did a great job orchestrating volunteers, but even so, we were far slower than we should have been getting the thousands of workers into these countries. And a large epidemic would require us to have hundreds of thousands of workers. There was no one there to look at treatment approaches, no one to look at the diagnostics, no one to figure out what tools should be used. As an example, we could have taken the blood of survivors, processed it, and put that plasma back in people to protect them. But that was never tried. So there was a lot that was missing, and these things are really a global failure. The WHO is funded to monitor epidemics, but not to do these things I talked about. If we look at the 20th century and we look at the death chart of the 20th century, I think everybody would say, oh yeah, there must be a spike for World War I. Sure enough, there it is, like 25 million. And there must be a big spike for World War II, and there it is, it's like 65 million. But then you'll see this other spike that is as large as World War II right after World War I. And most people, a lot of people would say, well, what? What was that? There's two kinds of flus. There's flus that spread between humans very effectively, and there's flus that kill lots of people. And those two properties have only been combined into a widespread flu once in history. Well, that is Spanish flu. We have no idea where it came from. It's called the Spanish flu because the Spanish press was the freest. They were the first to talk openly about it. And so in the annals of epidemic history, that's the big event. I funded a disease modeling group that uses computer simulation, and that work has been phenomenal in helping us target our polio eradication resources and which parts of Nigeria should we work harder on. And it's very natural, if you have a group like that, to say, hey, look at something like the Spanish flu in the modern day. Health systems are far better. And so you think, hey, that wouldn't be very bad. Well, we tried it, and there are some assumptions we had to make. But what we showed is that the force of infection because of modern transport, which compared to 1918 is over 50 times as great. And so if you get something like a flu, and you look at that map of how within days, it's basically in all urban centers of the entire globe, that is very eye-opening. That didn't happen with Spanish flu in the past. The opportunity to do more than just let it run its course is really only in the last decade. I think an epidemic, either naturally caused or intentionally caused, is the most likely thing to cause, say, 10 million excess deaths, and that it's pretty surprising how little preparedness there is for it. Now, it's tricky because this is a global problem, so how do countries work together, which countries should put up what resources, and every aspect of it, the resources to go engage in the affected countries, the allocation decisions. As we've seen various flu scares come along, we haven't had a super good response. So the paradigmatic examples are smallpox for an intentionally caused thing, that there was a simulation called Dark Winter that didn't come out very well, i.e. smallpox scored 1 and humanity scored 0. Flu epidemics, where we always talk about the potential recurrence of a 1917 like Spanish flu problem, and then Ebola, which although it was much smaller, there was some luck involved in that. Because it wasn't spread through respiratory contact, the reproductive rate was a lot lower, and it was basically people who were sick or dead who were doing most of the transmission. And so through a lot of heroic effort and a little bit of luck, it stayed under control and was largely contained to the 3 countries. Zika is still recent enough that the understanding of, okay, should we have seen it sooner? Even understanding what the steady state case looks like in terms of immunogenicity, why it showed up in South America and didn't show up in Africa. I know people are hard at work trying to answer these questions. So the lessons from that one, I'm not trying to minimize that one at all, but I think they're less clear than from Ebola.
And just to be clear, you think that there will be lessons learned and applied for the next pandemic? It seems sometimes, unless something is smacking us in the face, Bill, that people just don't pay attention, even when it comes to their own individual health, let alone public health.
Well, talk about being smacked in the face. What's going on here is mind-blowing. Never in my lifetime have we had to change our behavior and have this drastic effect on the economy in order to save lives. And, there are people who wish we didn't have to do that. That is fully understandable. This is some very tough medicine, but it's better to take the economic problem where the economy can come back than to allow it to spread throughout the country and take millions of deaths as the price that we have to pay here. And so, yeah, I think this is a smack on the head. This will cost trillions of dollars. They just passed a $2 trillion relief bill, and now they're talking about more. The kind of research to be ready for the next pandemic is a tens of billions number. So it'll look almost trivial compared to the price we're paying now. And that price would have been a lot lower if the world was more prepared.